Assessing the appearance and mental status, skin, hair, and nails. Assessing the appearance and mental status is an evaluation of the client's look and mental state in relation to his or her culture, socioeconomic status, and current circumstances. Assessing the skin, hair, and nails is an overall inspection of the condition of the integumentary systems that provide clues to the client's general health condition. The disease and disorder of the integumentary system may be local or caused by underlying systematic condition. Hi ma'am, I am Hazel Mendihar and I will be your student nurse. Are you Miss Kea Claire? So today ma'am, I'm going to have a assessment in your hair, skin, and nails. So ma'am, I will have a assessment in your hair and skin to know if there is some problems in your skin, if there is a diseases. And I want your 100% attention so that we will have the assessment done properly. And then, you need to do the hand hygiene to avoid cross-contamination among the clients. And provide privacy of the client. Assessing the appearance and mental status. First is observe body build, height, and weight in relation to the client's age, lifestyle, and health or any health activities of the client. Observes the client posture, gait, standing, sitting, and walking. Instruct the client to stand and sit. Ask the client to walk. While the client is walking, you should be in front of the client. Ma'am, can you stand? Sit, ma'am. Okay, thank you. Ma'am, can you walk? Okay, thank you, ma'am. Then, observes the client's overall hygiene and grooming. Relate this to the person's activities prior to the assessment. This is done by examining, identifying, and inspecting for any signs of odor and clothing of the patients. Then, observe for signs of distress in posture of the facial expression. Observe if the patient has an eye contact during the interview and the facial expressions of the patients. Note also the quality and quantity of the speech. Note any health and illness related and attitude of the client when examining or performing the assessment. Also, note the client's affect, mood, assess the appropriateness of the client's response, and listen for relevance and organization of thoughts. After doing the assessment, documents the findings of in the client's records. In assessing the skin is you need to assemble all the equipments. First, inquire if the client has any of history of any diseases. First is pain or itching. Ma'am, do you have pain? Do you have pain? Okay. Presence and spread of any lesions, bruises, abrasions, or pigmented spots. Ma'am, na ba kay mga kanang lagom-lagom sa imong panit? Skin problems. Associated clinical signs. Problems in other family members. Okay. Related systematic condition. Use of medications, lotion, or home remedies. Okay. Excessively dry or moist feel to the skin. Tendency to bruise easily. Dali ra ba maglagom imuhang kamot ma'am pagpisliton? Okay, so thank you. Next is, you need to wear gloves to prevent any forms of contaminating the clients. Also, gloves can create barrier if there are any open wounds. Then, inspect the skin color and its uniformity. Determine the skin color of the client that should be uniform to the sides of the body or the other part of the body. Assess edema. If present through pinching, make sure when you pinch it, should recoil and palpate for any lesion by using your index and middle finger. Palpate going to the upper extremities and on the other side. If there are any abnormalities, you can use magnifying glass to determine the type of lesions and to properly visualize it and measure using millimeter ruler. So during the assess edema, I didn't find any abnormalities on the skin. Next is palpate skin temperature. Compare the 2 feet and the 2 hands using the back of your fingers. And the temperature of the feet and the hands is the same. Assess the integrity by pinching the skin. Take note, if the patient is well hydrated, it goes back to its normal. There should be no signs of abnormalities or dehydration. Did you drink water a lot every day, ma'am? Then, document findings in the client record. Draw the location of the skin lesions on body surface diagrams. Assessing the hair. First is inquire if the client has any history of the following: recent use of hair dye, rinses, or curling or straightening preparations. Ma'am, imo ang book is natistingan na ba siya pa straight sa parlor? Okay, thank you. Recent chemotherapy. Nag-chemo na ba ka, ma'am? So, thank you. Presence of disease. Nabay disease iyang imuhang hair? Okay, so wala siya yung mga gibati. If the client is wearing a hairpin, remove it. And if the client is using wax, ask the client to the assessment. Ma'am, wala kay kanang gamit nga wax or gel sa imong hair? Okay, so thank you. Then, inspect hair thickness or thinness. So, if the client have a rubber band, remove it. Inspect hair thickness or thinness. Inspect the evenness of growth over the scalp using the hand. Make sure that your hand is in C form and you are in the back of the client. The hair of the client should have an evenness distribution. Inspect hair texture by inserting a pressure using your thumb. Make sure that the hair will not fall and should not be brittle in a normal individual. Determine oiliness. Pull the hair and ask the client to bend down hair head. Take note of the condition of the hairline of the neck. Can you bend, ma'am? Then, inspect the amount of body hair. Go in front of the client and determine any forms of receiving inner hairlines by assessing both sides. Then, document the findings in client record. Assessing the nails. First is inquire if the client has any history of the following. Ma'am, do you have a diabetes mellitus? So no. Peripheral circulatory diseases. Previous injury. Severe illness. Okay, thank you. Then, inspect fingernail plate shape to determine its curvature and angle. Normal curvature should in 160 angle. Determine the angle. There should be no inward movement or motion of the nails. Then, inspect fingernail and toenail texture. Determine for any vascular disease or peripheral vascular diseases. Then, inspect fingernail and toenail bed color. Determine also the nail plate color. Make sure that the cuticle is intact. Then, inspect tissue surrounding nails. Determine also that the surrounding of the nails doesn't have any deformities. Perform blanch test of capillary refill. This is creating small pressure into the nail bed of the client. Press 2 or more nails between your thumb and index finger. Look for blanching and return of pink color to nail bed. Ask the client if there is any pain during the test. Ma'am, nakapil ba ka og sakit pag akong i-press? Thank you. Then, lastly, document findings in the client record. This will keep all the records of the patient.